Here's a look at the latest numbers from the government on the coronavirus cases in India. The confirmed cases stands at 2,97,535, so slowly inching towards the 3 lakh mark there, and the death toll also has gone up to 8,498. Let's tell you also the state-wise data at this point. In Maharashtra, the confirmed cases stands at 97,648, the death toll at 3,590. Over to Tamil Nadu, where the number of cases stands at 38,716 with the death toll at 349. In Delhi, the third worst affected state in the country, the number of cases stand at 34,667, while the death toll is in fact crossed the 1,000 mark, is 1,085 now. So those are the figures that were put out by the Health Ministry. Later in the day, we're expecting, of course, an updated number after keeping in mind yesterday's figures as well. But let's also tell you the situation in the national capital. The Supreme Court yesterday had pulled up the Delhi government. This over the mishandling of COVID cases as well as patients' dead bodies. Now, the Kejriwal government has released a statement saying that the Delhi government accepts the Supreme Court's observations with utmost sincerity and that it will act on gaps brought to notice. Delhi government also said that an NHRC team has visited several hospitals, including the LNJP hospital, and expressed satisfaction. The Municipal Corporation of Delhi has reached unoccupied shelters for cremation of dead bodies. The Delhi Lieutenant Governor has now formed a panel of eminent experts to revamp Delhi's COVID strategy, to deal with the challenges that the national capital is facing, and also to ramp up medical infrastructure. Meanwhile, Delhi once again witnessed the biggest single-day spike in COVID cases. In the last 24 hours, 2,137 new cases have been reported and 71 deaths have also been confirmed in this single day.
Yes, the following visuals are going to be very disturbing, but we must force ourselves to see them, to know these stories, so we remember forever how our entire administrative setup crumbled as a virus stalked its victims. Kolkata, West Bengal. A small viral clip of dead bodies being taken to the Gadia crematorium by the Kolkata Municipal Corporation bears testimony to a collapsing system. The video shows decayed dead bodies being dragged to the crematorium with people protesting against the same being taken without identification. These are the horrific visuals.
बॉडी एकदम पूरा गला हुआ था, किसी को छाल नहीं था देह में, किसी को मांस गल के गिर रहा था, नहीं पूरा बेचित था, पूरा कपड़ा था उसकी देह में, ना कुछ पूरा जैसे माँ का पेट से निकलता है वैसा ही पूरा था. से देखे हम लोग आँख से ही देखे जब पूरा ढाल दिया आके हुक मारता था, घिच के बाहर फेंक ले गया था.
Balrampur, Uttar Pradesh. A 20-second viral video shows municipal workers dumping the body of a man in a garbage van in Balrampur. Social media anger forced district administration and the police to take action, following which 3 cops, 4 municipal workers are suspended. But this video, evidence of a system fraying at the edges. Delhi, the national capital. Disturbing visuals of 2 men pulling a dead body on a wheel cart in the national capital will leave you numb. Sunil Kumar was at the hospital to admit a homeless man when he saw these 2 men taking a dead body away towards India Gate on a wheel cart. He recorded what he saw.
एक ठेला पे 2 लोग एक डेड बॉडी को दिल्ली गेट की तरफ ले जा रहे थे. तो ये बड़े ही सोचने की विषय है कि ग्राउंड पे जो है हालात बहुत ख़राब हैं, और ये एक घटना नहीं, ऐसी कई घटनाएं हैं जिसमें कि लोगों के पास या दिल्ली पुलिस के पास भी पीएस वैन नहीं है जो कि लाशों को उठाने के लिए मदद कर पाए.
Jalgaon, Maharashtra. She was 82 years old, corona positive, lodged in a government hospital in Jalgaon. She went missing. Nobody found her for 4 days. Her decomposed body was found in a toilet after she went missing.
आज उसकी बॉडी जो है वो टॉयलेट में मिली है. और उसके बावजूद डीन को जब पूछा गया कि ये 4 दिन 5 दिन से क्यों नहीं हुआ, तो बोले कि 1 नंबर टॉयलेट की शायद साफ सफाई नहीं हुई होगी, इसलिए नहीं मिला। इसका मतलब है यहाँ पे टॉयलेट की या किसी की साफ सफाई भी नहीं होती और वार्ड में कोई जाके भी नहीं देखता है, जो कोरोना पॉजिटिव वार्ड है।
No dignity in death, no closure for the living. A cruel disease that feeds on what terrifies us most, dying alone, or of not being able to hold a loved one that final time, never to be able to say goodbye, or to say, we'll meet again. And for the lucky, unscathed few, to watch a system slowly crumble under the march of a deadly virus. Bureau Report, India Today.
And with the mounting death toll, the crematoriums in Delhi are also overwhelmed, stretching the last journey even longer and making the entire process for the families of the deceased even more painful. Watch this report from Delhi that's been filed by our correspondent Sushant Mehra and also video journalist Alok Das.
Delhi's coronavirus crisis is worsening by the day, and the death toll continues to mount. For the families of corona-positive patients, there is just no end to anxiety and struggle.
ये सैटरडे के मॉर्निंग में इनको सांस की प्रॉब्लम हुई थोड़ी सी। हम लोग इनको सारे हॉस्पिटल्स लेके गए, दिल्ली काफ़ी हॉस्पिटलों में दिखाया, परंतु किसी ने भी बेडेड के लिए मना कर दिया। इवन एंटर करने से ही मना कर दिया हम लोगों को। हॉस्पिटल के अंदर कोई भी लेने के लिए तैयार नहीं था।
Right from managing to get a test done to getting admitted into a hospital, it's a long, drawn, painful process, even when it ends in death.
मेरे फादर का नाम है प्रेमचंद। उन्होंने मुझे पहले रमेश चंद की बॉडी दे दी, फिर मैंने उनको देखा तो मैंने कहा ही इज नॉट माय फादर। तब उन्होंने मेरे को बोला अच्छा फिर आप वेट कीजिए, अभी आपकी बॉडी तो आई नहीं है। सर इतनी लापरवाही।
Due to the increasing number of deaths, the situation at the crematoriums is also worsening. With ambulances and hearse vans bringing in bodies one after the other, the crematoriums of Delhi are overwhelmed.
कोई व्यवस्था नहीं है सर शमशान घाट में। लोग बॉडी लेके आ रहे हैं, उन्हें 5-5 से 8-8 घंटे तक की वेटिंग मिल रही है सीएनजी में। सर उन पे सुविधा ही नहीं है। पहले की सर 2-2 दिन की तो मोचरी में बॉडीज पड़ी हैं। मैं मोचरी में देख के आई हूँ, 2-2 दिन की बॉडीज दे रहे हैं वो आज। सबसे बड़ी बात है, और आज मैं जबरदस्ती मेरे पेशेंट की बॉडी में जबरदस्ती लेके आई हूँ।
At Nigambodh Ghat crematorium, relatives of the deceased wait for hours for their turn. At times, rituals have to take a back seat, and last rite process has to be cut short to accommodate those queuing up behind.
हम सुबह यहाँ से 10 बजे से आ रखे हैं। उन्होंने 4 बजे का टाइम दे रखा। सुबह से डेड बॉडी यहाँ कार में रखी हुई है। उसमें आप सबको पता कितनी गर्मी है, कैसा है, इतनी भीड़ है, इतने लाखों में लोग आ रहे हैं यहाँ। कोई मर रहा है, किससे मर रहा है किसी को कुछ नहीं पता। कोई सस्पेक्टेड है, कोरोना है, किसी को लकड़ी में जा रहे हैं, किसी को इसमें। और लगा लो अभी 4 बजे का टाइम दे रखा है और पता नहीं, हमें नहीं पता कब तक टाइम आएगा।
Such is the situation at the capital's biggest cremation ground, but it is no better at other crematoriums. The Punjabi Bagh cremation ground, which is currently reserved for COVID funerals, has a capacity for 66 bodies in a day. But on Thursday, it received 73 bodies, and that was till 3 p.m. in the afternoon.
मौत का आंकड़ा दिल्ली के अंदर बहुत अधिक है। एक ही समय में कम से कम 20 से 25 डेड बॉडी का दाह संस्कार किया जा रहा है, और पंजाबी बाग की जो कैपेसिटी है एक दिन में वो 66 कोरोना संक्रमित व्यक्तियों का हम दाह संस्कार कर सकते हैं। तो आज केवल एक ही बात कहना चाहूँगा कि यहाँ जो डेड बॉडीज आ रही है वो कल ज़्यादा इसलिए भी आ गई थी क्योंकि कुछ डेड बॉडी LNJP हॉस्पिटल से जानी थी आपकी निगमबोध घाट, वो किसी कारण से वो पंजाबी बाग आ गई, जिसको कि हम परिवार वालों को किसी तरह से तकलीफ ना हो, इसके कारण हमें वहाँ उनका दाह संस्कार करना पड़ा।
Delhi has 13 cremation grounds, of which 6 cremation grounds are authorized to conduct the last rites of COVID-19 positive or suspected cases. And with the death toll mounting, Delhi government is now getting 4 additional crematoriums made. This report filed by Sushant Mehra for India Today TV.
Now, with the number of COVID cases growing, the deaths are also on the rise. And it's not just in Delhi, but also in western cities like Mumbai as well as Ahmedabad. Electric crematoriums across Mumbai are now overburdened with, in fact, multifold increase in the number of bodies arriving for cremations. BMC has now prepared a dashboard that displays details of 46 crematoriums with gas and electric cremation facilities. In Ahmedabad, cremation centers are working at double their capacity. Some of the cremation grounds are seeing double the number of bodies these days. Well, an embarrassed BMC has cancelled order for body bags for the corona deceased after prices were found to be much higher. This after India Today followed up on the issue with the civic body. Kamlesh Sutar gets you this report.
A body bag scam in the middle of the war on coronavirus. The Mumbai Municipal Corporation has cancelled a contract for body bags after it was allegedly found to be buying them at double the prices. The BMC had issued tenders for safety equipment, including masks, gloves, PPE kits and body bags in April. The contract to provide body bags was awarded to Vedant Innotech Private Limited for 6,719 rupees per bag.
I looked up on MCA website. I saw that the company used to manufacture metal castings and chemicals. So what is this kind of a company doing with manufacturing body bags? And today the tender has been cancelled. Everybody should know that these body bags are readily available from 300 rupees to about 1200 rupees.
Even in the US, such body bags were acquired at $51. That's roughly 3,900 rupees. The exorbitant prices were justified by the BMC by citing specifications like leak-proof material. But now, with allegations of corruption emerging, the state government has ordered an inquiry.
I think that this needs to be properly inquired. Like 300 rupees cannot be a cost of a bag. If there is a possibility that someone has purchased it at a very higher cost, we will 100% call for an inquiry, and if found guilty, we will come heavily on that.
The BMC too has reacted. Commissioner I.S. Chahal says, earlier the contract was given to this company as other companies who participated in the tender procedure failed the leak test. We also inquired in Delhi and Jaipur where bags of similar specifications were bought at much lower costs between 2,500 to 3,000 rupees. Hence we have decided to cancel the contract and have ordered retendering.
During the COVID-19 situation, the BMC has been at the receiving end for not providing proper facilities and also mishandling of the situation. But important among them has been the procurement of things like masks and PPE kits. The way bodysuits have been procured at a higher price, this might just be the tip of the iceberg. With camera person Raju Inamdar, Kamlesh Sutar in Mumbai for India Today.
Let's also get you the latest numbers from Maharashtra on the coronavirus cases. The state has registered 3,493 positive cases in the last 24 hours. Total cases is now nearing the 1 lakh mark. As many as 127 coronavirus-related deaths have been reported from Maharashtra in the last 1 day. Now, while Maharashtra is the worst affected state by coronavirus in the country, Mumbai leads among the cities with over 55,000 cases and 2,044 deaths. Mumbai registered 1,366 new COVID-19 cases in the last 24 hours and 90 deaths as well. In what, however, comes as some good news, the recovery rate in the state is at 47%. About 1,718 patients were discharged after recovery yesterday, taking the number of recovered patients now in Maharashtra to 47,796. So as our numbers steadily rise, India has now become the 4th worst hit nation by coronavirus in the world. With this increase in the number of cases, several states are now facing questions over the number of COVID tests that are being conducted as well as its results. There is a wide variation in testing among states. While India has been steadily testing more people every week, in fact, some states are testing far too few. Gujarat, which is one of the worst hit states, has the 5th fewest tests in the last week. Gujarat is only testing 84 people per million population. Some states are testing too few people in relation to how many cases they have, with in fact the test positive rate of 15.28%, 11.9% and 8% respectively. This is Maharashtra, Delhi and Gujarat. They're all in the most trouble. Among the 5 states that have the highest number of active cases, it's only Tamil Nadu that actually increased its testing capacity substantially really in June. Also getting your news from Uttar Pradesh this morning, a retired IAS officer has been booked for questioning the state government's testing policy and strategy to tackle the coronavirus outbreak. An FIR has been filed against senior bureaucrat Surya Pratap Singh under charges of disobedience to an official order and violation of the Epidemic Act. UP BJP spokesperson Hero Bajpai accused the bureaucrat of spreading false propaganda about the state government. Congress leader Priyanka Gandhi Vadra launched a scathing attack at the Yogi government. Tweeting a media report about the arrest of the IAS officer, Priyanka accused the state government of trying to keep people in the dark by simply not testing enough. Welcome back. Well, Cyclone Ampan may have caused destruction in the city of Kolkata, but it certainly could not bring down their spirits. And green crusaders of the city are back to make it once again pleasant by replanting trees uprooted by the cyclone.
Days after Cyclone Ampan ravaged Bengal, uprooting over 16,000 trees in Kolkata, volunteers and citizens groups have launched an initiative to replant and save some of these very old trees.
We have identified in last few weeks a few trees which we have marked them. Then we have got some experts who have treated those plants. We have pruned them. As per the discussion that we have with experts, there are very high chances that these trees which we have identified will survive. Planting maybe 100 saplings and replanting one of these trees probably will have the greater impact. So that is the objective.
The process might look easy, but is extremely complicated. The trees to survive need special care.
सबसे पहले हम लोग ट्री को आइडेंटिफाई करते हैं, उसके बाद हम लोग उस जगह में एक बड़ा होल करते हैं जितना उसका सरकमफ्रेंस है, उसके हिसाब से फिर हम लोग ट्री को धीरे धीरे क्रेन और ये आप देख रहे हैं क्रेन की और जेसीबी की मदद से हम वहाँ उसमें रखते हैं और उसके बाद हम लोग कंपोस्ट देते हैं जो वर्मी कंपोस्ट होता है विच इज़ द मेन फूड ऑफ दीज ट्रीज. जो भी फंगिसाइड और एंजाइम्स हम लोग को ज़रूरत है वो हम लोग दे रहे हैं और प्रॉपर इसका ट्रीटमेंट भी ज़रूरत है. तो इसलिए हम लोग इसका प्रूनिंग करके ट्रिमिंग करके जहाँ जहाँ इसमें वो चोट लगी है उसको हम लोग मेडिकेशन करके इसके बाद ही हम लोग इसको रिप्लांट कर रहे हैं.
At least 40 full-grown trees uprooted by the cyclone have been successfully replanted by these green warriors so far.
Mostly the old age trees gives more oxygen than the new planted trees because the new planted trees will yield oxygen around, it will take 20 years, 25 years. But these trees, if they are taken care of, they will start yielding oxygen maybe within 5 to 6 years. So we must emphasize on this that these uprooted trees must be restored and replanted.
And at a time when the state government has said a few crore saplings would be planted across the state, some green activists say that will take a long time to somehow bear fruit and give oxygen. With shrinking oxygen cover and green cover in the city, this is an effort that has been taken so that Kolkata can see some of its green cover resurrected. With camera person Probir Biswas, Indrajit for India Today in Kolkata.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.